The rationale for our BELIEVE trial is as follows. The trial is concerning patients with a tumor which has an activating EGFR mutations. It's the most frequent targetable disease in lung cancer. Of course, nowadays the approved treatment for those patients is a first-line treatment with an oral drug, an EGFR TKI inhibitor. The question is, can we do better than with the current results? Now, the trial was based on a hypothesis, was generated by Professor Rosell and his observation in his Spanish lung cancer study group. When probed with very sensitive methods, even before treatment, the resistance mutation T790M can be documented in about a third of the patients. We know very well after treatment, on progression, most patients have a demonstrable T790 mutation, but some clones appear already to be there at diagnosis. There has been preclinical studies which have shown that tumor which carries those resistance mutations are sensitive to anti-angiogenic agents. So the hypothesis was to combine Erlotinib and bevacizumab to improve the outcome for those patients who have this pre-treatment T790M mutation. And we have reached this endpoint. The goal was to have more than 65% one-year progression rate of progression-free survival for this cohort of patients, and this has been reached in this trial. This trial was an open-label phase 2 trial which directed two cohorts. One cohort of patients were demonstrable T790M mutation at diagnosis, the other cohort without demonstrable T790M mutations. I will present today the progression-free survival rate and the median progression-free survival for the cohort with T790M mutation and without T790M mutation. The progression-free survival for the cohort with T790M mutation was 16 months, which compares very favorably across studies with the control, the earlier Spanish lung cancer group. There the progression-free survival was below 8 months. Now, of course, this was a phase 2 trial, but our data really support a randomized study which was done in Japan, a randomized study between Erlotinib alone or the combination in a similar group of patients. The safety data of our study was really in keep what was to be expected. It's a combination of the safety data from Erlotinib, where the major side effects are rash or some diarrhea or fatigue, and the data from bevacizumab, where we know hypertension is certainly a safety issue. However, hypertension can be treated in the patient, so it's not something that lingers. So I will report on progression-free survival. What I will not report here yet is overall survival data. It's much too early, and we have a large number of translational research questions that are still undergoing investigation, so there'll be room for further reports. Now, as to the clinical need, I do not think it needs another phase 3 trial. Our data with the phase 2 trial support the Japanese data, a randomized phase 2, and I really would hope that this combination would reach our patients.